Hi guys, my name is Virginia West Breton and this is my final PowerPoint presentation on the disease osteoporosis. So this first slide is looking at the basics of osteoporosis. Osteoporosis is a disease where the density and overall quality of a person's bones are reduced. This can lead to weakness of the skeleton and can increase fractures. An article written by Karam and a few other authors from 2018 explains osteoporosis represents a major global public health problem, especially among elderly people. It is one of the most common metabolic bone diseases. If you look at the graphic on this slide, you can see a visual showcasing the changes that take place in the bones when a person has this disease. This slide is looking at the types of people most commonly affected by osteoporosis. As you can see, this disease can affect men and women of all races, but the most commonly affected are white and Asian women, typically older women who have already experienced menopause. Anyone can have this disease, but these are just the types of people who have the highest risk of osteoporosis. The other risk factors of getting osteoporosis are as follows. People with family history of osteoporosis due to genetic inheritance, people with a smaller body frame because they have less bone mass to draw from as they age, people with lower sex hormones because it is shown that this decrease tends to weaken bones, people with thyroid problems because too much of a thyroid hormone can cause bone loss in a person, and also people with overactive parathyroid and adrenal glands. Osteoporosis has been more detected in people with these problems. There are certain causes of osteoporosis, such as people with a low calcium intake because it contributes to a lack of bone density, people with eating disorders because the restriction of food intake obviously weakens the body, gastrointestinal surgery because this type of surgery limits the surface level to absorb nutrients, and lastly, certain steroids because they can get in the way of the bone health and rebuilding process of the body. So some other causes of this disease are certain medical conditions such as celiac disease, IBD, lupus, etc. People with these conditions have a higher risk of developing osteoporosis. It is also a risk factor to live a sedentary lifestyle, to have tobacco use, and excessive drinking due to the obvious dangers they present. So the symptoms of osteoporosis are easier bone breakage, bad posture, back pain, and overall height loss. If you look at the accompanying graphic, you can see some extended examples of these specific symptoms. So other symptoms of osteoporosis are brittle fingernails, decreased strength in a person's body, receding gums in someone's mouth, and overall bone pain. These are the symptoms to look for when trying to detect and diagnose osteoporosis. Treatment of osteoporosis can be done through certain medications, such as alendronate, ibandronate, risodronate, etc. A healthy diet can help prevent the disease. It is also important to limit cigarettes and alcohol usage. Lastly, regular exercise can massively help as well. This slide will take a look at a reference that provides information on possible treatment for osteoporosis. An article written by Horge and some other people from 2016 states, moreover, Shahal and et al. Examined healthy women with an average age of 49.8 years, which exercise at least twice a week in a fitness center, and concluded that physical activity at high intensity and high frequency has beneficial effects on both muscle strength and bone mineral density. This helps to prove that exercise can be a viable treatment for this disease. An article written by De Souza et al. In 2010 explains these are experiences in which individuals do not feel significant limitations to their everyday activities. Therefore, these individuals enjoy total independence and autonomy in the face of a disease that is still configured as something invisible in their lives. In conclusion, osteoporosis is a common disease, but with the right treatment, people can still live healthy and happy lives. It is important to understand the causes, symptoms, and the possible treatments of a disease because this pursuit of information can significantly improve their lives. This last slide is the references used for this assignment. Thank you so much for listening to my PowerPoint on osteoporosis.